Wearing a mask and gloves and frequently washing hands have become common practice in the pandemic, but they may have been looked at a bit differently prior to 2020. During Mental Health Awareness Month, NBC 26's Jenna Bree tells us how therapists are changing the way they treat their patients with OCD.
The definition of mental illness has changed over the past year.
If someone came in and said, like, oh, I insist on wearing gloves or wearing a mask when I'm in public, we would have said, nope, that's excessive. That's the anxiety, not real. And now, that is a norm.
Therapist Maria Recker used to treat patients with contamination OCD and anxiety with exposure response therapy.
Have someone go in public, touch things, and not wash their hands. We can't recommend that anymore because it's not actually safe.
She says therapists are still figuring out what the future of treatment will look like.
The world is dangerous. We are encouraging a lot of things that previously we would say are rituals and we would want to cut out.
This May, Recker wants people to know there's no shame in getting help.
People judge those with depression or anxiety, think they're lazy or weak, but we don't blame someone who has cancer and say, like, well, if you just tried harder, your cancer would disappear, your tumor would be gone. But with mental health, it's seen as their fault when it's not.
And clinical supervisor Laura John says mental illness can affect anyone at any time in their life.
If you don't think you're going to be affected by it, you potentially can be, whether that's you or a loved one.
But thanks to teletherapy, there's more access to help now than ever before.
I think it kind of opened this door to this new way of looking at therapy, and I do think it's normalized it somewhat.
Although more patients are getting back to in-person treatment, Recker says over the past year, she's been able to help people virtually, even those who live in different states. And she doesn't see that going away anytime in the future. In Green Bay, Jenna Bree, NBC 26.